This video will introduce you to the superficial structures of the heart. Let's start by looking at the heart within its larger context, so within the thoracic cavity of this, a model that should be familiar to you. If not now, it will be very soon. This is the torso model. Okay, so let's start where deoxygenated blood, that is blood draining from the systemic circulation, enters into the heart. All right, so what we can see is two branches, blue branches, right, carrying quote-unquote deoxygenated blood, draining from the right side and the left side of the body. These are the brachiocephalic veins. All right, so this one here is the right brachiocephalic vein. This is the left brachiocephalic vein. Where these two come together, we see the formation of the superior vena cava or vena cava, however you want to say it, is okay with me. So here is the superior vena cava, and this is going to drain into the first chamber of the heart. We can't see the chamber, but we can see the superficial surface, and there is an extra little, almost elephant ear-like flap that actually allows for a greater expansion of this chamber. So this superficial structure is the right auricle, auricle for ear, the right auricle, and that is the superficial surface of the right atrium. All right, so blood drains from the superior body through the superior vena cava. From the inferior part of the body, right, here's the liver, we can see that there is a little, a very large vessel here. It is also blue, and that is the inferior vena cava. Both are draining blood into the right atrium. Okay, to follow the path of the blood is pumped from the right atrium into the right ventricle. Here, we can't see the chamber itself, but we can see kind of the boundaries of that chamber. Okay, so note the red blood vessel here and the red blood vessel here. This blood vessel is delineating the boundary between the right atrium and the right ventricle, and it is called the right coronary artery. That is, it is carrying oxygenated blood to the heart muscle itself, to the myocardium. Okay, for here we can see a red vessel that is delineating the right ventricle from the left ventricle. This here is called the left anterior descending artery. Right, so it's on the left side, it is descending down. Okay, and of course it's an artery. Here it is red, carrying oxygenated blood away from the heart. Okay. All right, so from the right ventricle, blood is pumped up through this blue vessel right here. Now this vessel is taking blood away from the heart and actually to the lungs on either side, and so this is actually a type of artery. Right, so this pulmonary circulation, which is what we're entering into, is one of the very few instances where arteries will be blue and veins will be red. So this first structure right here is called the pulmonary trunk. It quickly splits, and we can see one of these branches right here going to the left lung. All right, so this branch right here is called the left pulmonary artery, and again it branches off the pulmonary trunk right here. Okay, so blood is reoxygenated here within the lung, and it's going to return to the heart, in this case to the left atrium, via these red vessels right here. If we turn this a little bit, we can see that there's actually quite a few of them. All right, so these are always on the more posterior side of the heart. These are red vessels. That does not indicate that they are arteries. It indicates that the blood within them is going to be oxygenated, right? So recently receiving oxygen from the lung here. All right, so these two vessels are we're on the left side, so they are left. They are pulmonary, they're coming from the lungs to the heart. And the fact that they're going to the heart means that they are going to be called veins. So left pulmonary veins, as opposed to the blue up here, the left pulmonary artery. Okay, so oxygenated blood returns to the left atrium here. Again, we can't see the chamber itself, but we can see this little elephant ear-like structure here. This is called the left auricle. Okay, so reoxygenated blood is going to be pumped from the right atrium the left atrium, excuse me, into the left ventricle. And the left ventricle is much larger. We can see that it includes this point down here, right, the apex, the point of the heart. And so this is the left ventricle. We can see the boundary of the left ventricle versus the right ventricle. We talked about this before. This is the left anterior descending artery. If we turn the heart just a little bit, we can also see that there's another red coronary vessel that is actually traveling at the boundary between the left atrium and the left ventricle. This here is the left circumflex artery, and both of these are actually branches off the left coronary artery. The branching actually happens posterior to this auricle here. And we might be able to see that from another perspective later. Okay, so blood is now in the left ventricle. All right, it is then pumped back out of the heart to the systemic circulation, to the rest of the body. So here, the left ventricle, blood goes to the aorta. All right, so this here is the nice arch structure. This portion where blood is ascending is called the ascending aorta. Blood is going to wrap around to the back of the heart in the aortic arch, and we will look at that from another perspective now. Okay, so this here is another heart. We can see largely the same structures, but let's just walk through from the beginning once again. All right, so this is the anterior side, just like we saw up here. Same perspective we're starting with now. All right, here are the two brachiocephalic veins coming together to form the superior vena cava. All right, this is what we can see. The superficial part is the right auricle, which is the superficial portion of the right atrium. And just to give you a little bit of an idea here, this here is the chamber. We'll talk about that in another video. That is the right atrium. This superficial portion here is the right auricle. All right, blood then goes to the right ventricle. Here we can see a red blood vessel. That is the right coronary artery. And from this perspective, if we get the auricle out of the way, we can actually see that the right coronary artery is a branch off of the aorta. And we'll get into that in just a moment. All right, so this here is the right ventricle. We can see the boundaries with the right coronary artery and the left anterior descending artery. All right, blood then goes up through here, the pulmonary trunk, and the pulmonary trunk is going to split. Right? One vessel is going to go behind the heart, as we can see here. Right, so it goes behind these other major vessels here, and it's going to go to the right lung. So this is the right pulmonary artery. This is the left pulmonary artery. Blood goes to the lungs, and it's going to return to the left atrium. Here we can see the left auricle. These are the left pulmonary veins. Even though they're red, they're going back to the heart, and therefore they are veins. Right, if we turn the heart all the way around, we can see that there are blue vessels and red vessels. The red vessels are the pulmonary veins. The blue ones here are the pulmonary arteries. And we'll take a look at this again in just a moment. So going back to the anterior surface of the heart, blood has returned from the lungs. To the left atrium is the chamber. This superficial chunky structure here is the left auricle. Large structure down here, this is the left ventricle. And remember that the left ventricle includes this little point down here. This is the apex of the heart, as opposed to the fatter portion of the heart, which is up here with the vessels and the atria. Okay, so blood goes from the left ventricle up and out of the heart through the aorta. The ascending aorta, blood is ascending towards the head. Here is the aortic arch. And then the descending aorta, it's been cut off on this model, but it goes down behind the heart and all the way into the abdominal cavity. Okay. There are a few other structures that I want to point out that are visible in this model that were not visible in the last model. First of all, there are three branches coming off of the aortic arch. I like to remember these as BCS. Okay, so the Brachiocephalic Trunk, right, is this red vessel right here. Remember that these two are brachiocephalic veins. This is a brachiocephalic trunk. Big difference. Make sure you study that hard. And so BCS, Brachiocephalic Trunk, the left common carotid artery, and the left subclavian artery. And we'll look at those on other models and other videos. All right, also what we can see here is that there's a little something connecting the aortic arch with the pulmonary trunk. And so what this is a remnant of a fetal vessel. Okay, so actually a vessel that was present while you were in utero. It has since become essentially a ligamentous scar, but we can still see this. This is called the Ligamentum Arteriosum. And again, it is a fetal or scar of a fetal structure connecting the aortic arch and the pulmonary trunk. Okay. Now, what we've been looking at so far is the anterior heart. There are a few vessels on the posterior heart that I want you to be able to see. So on the posterior heart, what we can see is that this is the right side, this is the left side, this is the superior vena cava, the inferior vena cava. Now these two vessels aren't the only way that blood can return into the right atrium. There is a third vessel, and that vessel is this very large blue vessel right here. It is draining blood from the entirety of the cardiac muscle, so of the myocardium. This is called a coronary sinus, right? A big open vein draining blood back into the right atrium. Now this vessel actually is set within a groove on the posterior side of the heart. We can see up here, this is where the atria are. Down here, this is where the ventricles are. And so this groove here is called the atrioventricular groove or atrioventricular sulcus. Now that's the groove, that's the structure on the heart. The vessel itself is the coronary sinus. Okay, couple other things I want to point out, again, from the posterior side of the heart. Here we can see the aortic arch, BCS, brachiocephalic trunk, left common carotid artery, left subclavian artery, and this is the descending aorta, which would continue all the way down to the abdominal cavity. Okay, these two blue vessels here are the pulmonary arteries. These are the pulmonary veins. Now this final vessel right here is called the Zygos Vein. It's actually draining blood from your thoracic wall, and there's only one of them. It's not paired, and this is the only place that you'll see it is on the back of the heart. Okay. Final model. All right, we're going to go through this real fast because we've seen these structures before. Brachiocephalic veins, superior vena cava, right auricle, right coronary artery, right ventricle, left anterior descending artery, pulmonary trunk, left pulmonary veins, or sorry, left pulmonary arteries, excuse me. This little tiny white structure right here is the ligamentum arteriosum. These red vessels right here are the pulmonary, or specifically the left pulmonary veins, left auricle, left ventricle, apex, ascending aorta, aortic arch, descending aorta has been cut off, BCS, brachiocephalic trunk, left common carotid artery, left subclavian artery. On the back, the Zygos vein, descending aorta. If we look down here, we can see the groove, the atrioventricular groove of the structure of the heart, and this here is the coronary sinus. And that is all for the superficial structures of the heart.